It's pouring in Chandigarh, but the party goes on. The Thursday Ladies Club is hosting its very own Botox bash, and as Dr. Kapoor, one of the city's top dermatologists, presents this new elixir of youth, he clearly has a rapt audience.
Once they see that this procedure is so easy and it takes just 10 minutes for the whole procedure and there's hardly any discomfort or downtime, so they get courage to experiment it on themselves also.
A lucky draw right after wins 2 women free on-the-spot Botox shots, otherwise worth approximately 18,000 rupees. Curious to check out the wrinkle zapping technique, the women gather close, pulling back briefly when the ominous-looking syringes come out.
Why do you want to try Botox out?
I just try to feel it, how it looks. I'm 51 years old. If I feel it look good on me, I'll continue it.
I think it's not very painful. After doing this, I am feeling perfectly all right. And I think we'll see the result after 2-3 days, as doctor says.
Now it's not for jewelry that they're saving. They say, I have saved this for Botox or anything like this.
Botox lunch parties are now the rage in affluent towns like Chandigarh. Often sponsored by Allergan, the manufacturers of Botox, they're designed to reposition it from a luxury product for aging celebrities to a beauty solution for the young and middle class in smaller cities. The promise of huge discounts for those who sign up for Botox shots only helps.
They have money, they want to look good. They come for even as young as 23-year-old females come to us for Botox, for fillers, for fractional laser, which are pretty expensive. And all these things, information they get from internet. In their idle time, they sit on internet, just put how to avoid anti-aging, and come so many things. They come and they don't say, doctor, what's wrong on my face, or whether this is wrong, what to do. They come and they say, doctor, this is wrong, and I have read, these are the treatments. Do you have them?
As patients turn consumers and the clinical gives way to the cosmetic, the practice of dermatology has gone through a makeover of its own. In less than 5 years, Dr. Paramjit Walia has seen his small dermatological clinic transform into a thriving and lucrative enterprise.
I started my practice in 2001, and for first 3 to 4 years, I practiced like a dermatologist. You know, seeing itching, bad looking lesions and hair loss and these kind of things. But in last 4 years, as a doctor, as a professional, our trend is changing more towards cosmetic. Reason being, there is big money for us also, and there is big clientele into it. Though we do practice our dermatology alongside. And same is the trend with the skin seeds. Like all the young doctors who get streams in different like medicine, surgery, radiology. Now the skin seat is, finished in top rankings, 3-4 rankings. Because now skin is really minting money for doctors.
Chandigarh also throws up an unexpected statistic. Local dermatologists have found that from a ratio of 95% female to 5% male Botox users 3 years ago, 1 in every 4 Botox shots is now given to a man.
अगर औरतों का अधिकार है सुंदर दिखना, तो मर्दों का भी अधिकार है। पहले आपके विचारों की ज़्यादा अहमियत होती थी, अब आपकी पहचान ज़्यादा चेहरे से होगी, क्योंकि मीडिया का इन्वॉल्वेशन बहुत ज़्यादा हो गया है। हर कोई लाइमलाइट या अपने आप को उजागर करने की कोशिश करता है, तो हम भी उनमें से एक हैं। हम भी चाहेंगे कि हमारा भी चेहरा अच्छा हो।
They often come from neighboring towns in search of the man they long to see in the mirror. It's a search that can get compulsive, and 24 procedures later, this visiting patient is still not satisfied.
अब तो आदत सी पड़ चुकी है मेरे, तो जहाँ तक मेरे को याद आता है, मेरे तक 25 ऑपरेशन तो हो ही चुके हैं, ज़्यादा ही हो चुके हैं। 1996 से 2009 ऐसी सोच है जो आप करना चाहें उसकी कोई कीमत नहीं होगी। वो आप पे डिपेंड करता है आप उसको कैसे करते हैं, किस जुनून तक आप उसमें जा सकते हैं?
Vulnerability to assaults on self-esteem is not a gender-specific vice or virtue. So, with greater importance on appearance, greater importance on presentation, it isn't particularly surprising, this changing social mode, as it were.
The cost of Botox may have halved from when it was first introduced in India in 2006, but an average procedure still costs at least 5,000 to 6,000 rupees. So is this a case of Punjab's prosperous farmlands feeding a passing fad, or is there a more enduring reason for the growing male consumption of Botox in Chandigarh?
Property in Mohali, around Mohali and in Punjab has got very expensive, especially agricultural property. So a very poor farmer with only 5 to 10 kilos got rich overnight, and his kids bought big SUVs, big bungalows, and they all want big, good, nice tattoos and Botox and lasers. And another thing, most of these guys and girls from Punjab, they are planning to go abroad, and before going abroad, they should look best. Third aspect is, there are so many people here who are divorced or single. They want to get married again. This is major junk in age group of 30 to 40s who are ready to get married again, or they are looking a match for them. They have money, they just spend on them to look younger. It's as simple.
So does the burgeoning market for age-defying products signal the end of natural, graceful aging?
We lose our teeth, we get new set of teeth. Our knee joints, they become redundant. We get total knee replacement. Our heart vessels, they get blocked. We get stenting done or a bypass surgery done. Then why not make our face, our body, our skin look young again? What's the harm?
Back in Delhi, we head to the Men's Fashion Week, the destination for every self-respecting metrosexual man, the altar of male vanity.